I've worked in healthcare for over 30 years. I loved it, absolutely loved it. I worked in nursing. I worked in labor and delivery, uh, market and supply, med surg. I did it all. And especially, and I worked in some nursing homes, and especially nursing homes, I witnessed. I witnessed some horrific acts by the nursing staff toward some of the residents. Horrific. And you know, you are just as guilty as they are if you don't report. And I said that to say this. So many things happen behind closed doors in the healthcare industry, period. I remember one a resident that couldn't speak, that couldn't do anything for herself. One of the male nurses ended up getting her pregnant, and how nobody knew that could tell that she was in the pregnancy stage. I still don't understand that. And also about how somebody was pouring acid. I can't hardly repeat it. Pouring acid in one of the residents' bed sores. And with my daughter, she was 36 when she became ill and sick, but she couldn't do anything for herself. She was diagnosed with congestive heart failure. And I was still working at the time. I was going between my days off. We were like taking turns going to see about it, because she was like 2 hours from me. And the last time I didn't know this was going to be my last day of work. But when I got ready to go to drive to go see her and spend some time with her, when I got there, trays of uneaten food was in her room. Well, and nobody had tried to feed her. Her bed had been changed or cleaned, and you could tell by looking at her that she had not been bathed, and nobody had housekeeping had not come in to clean her room. Her room was filthy, and the tools that the nurses would use, like IV and suction and all those that came in the package, the containers, and some of the disposable needle caps were on the floor, and some were all over her bed. And I'm just trying to tell you guys that if you have family that's incapacitated, that's in the hospital or nursing home, that can't do anything for themselves, if you have any love for your family, don't leave their bedside. And when I saw that, I called my job where I was working, and I quit over the phone. And I didn't go back to work until I didn't go back to work. 'Cause I said I was not gonna let anybody. Um, I wasn't gonna leave my baby by herself anymore. And one of the nurses, after I got done cleaning her room and changing her beds and giving her bath and making sure she had eaten, and I had washed her hair, and she had beautiful hair, and I washed her. I gave her a bath and everything, and I oiled her up with olive oil from her face to her feet, and the skin off her feet was peeling. And I don't. Her feet had swollen so big, and she had got bed, so she had gotten a bad bed sore. But when I got done cleaning her up, cleaning her room and everything, and oiling her down, one of the nurses came in and saw her, and she began to weep. She began to cry, and she said that she knew that my baby had given up because nobody was there. No family members were there. Had come to be with her in in quite some time. I guess maybe a few days. And she just said she felt like my daughter had given up because she felt like nobody wanted to be bothered with her. And the nurse just she cried when she saw how good and my baby was looking and how good she smelled, and she said my baby had smiles. Oh my God, forgive me. She said she hadn't seen my baby smile, until the day that she walked in and I was in there with her. But she was really headed for hospice care. And eventually they ended up discharging her, and the ambulance brought her home. And she was surrounded by family members the whole time that she was at home. And they had said that she probably would live for no more than 3 days, but she lived for 7. And but just make sure that you that you take care of your family if they're in a hospital or any kind of healthcare facility. Don't leave them by themselves because you never know that someday it may be you that needs your family there with you.